Let's get some reaction. Health activist Dr. Kgosi Letlape joins us to further expand on this. Dr. Letlape, very good evening to you. Thank you so much for your time. The minister says there's a misconception around the word absorption in the healthcare sector. What are your thoughts?
I think it is quite sad in a country where we have a need for doctors to hear our minister talk about in terms like that. What should be happening is there should be proper human resource planning, proper budgeting, proper spending, so that we stop wasting money, we stamp out corruption, we take out human resources that are not needed in healthcare, and we employ nurses, doctors, pharmacists, and other healthcare professionals that are essential. What you do not hear the minister say is that we have adequate human resources, our posts are filled, and our people are being served properly. There's no overwork for the staff members. There's quality care being provided. You don't hear any of those issues, and that is extremely concerning.
I suppose the frustration that even exacerbates the situation is that, having a look at the story that we've just run from the Eastern Cape, is that the province has a critical shortage of professionals at public healthcare facilities. It begs the argument, why are the doctors who are unemployed not being given opportunities to be employed in the vacant positions?
Because the budget is being blown away on things that are not necessary. People are overpaying when they are procuring. There are people that run facilities that don't have the skills to run the facilities. We need to make health a national competence so that we can have proper, constructive, strategic buying. Use the buying power of buying for the nation to get the best prices on the market. Use original equipment manufacturers. Professionalize the service, in-source. Give devolution of powers to institutions so that the CEOs can run their units as business units. They must have maintenance departments to maintain. So we don't only need doctors, we need other healthcare professionals. We need maintenance people in our institutions. For health to work, it needs to be made a national competence. And for provinces like the Eastern Cape, they need to be put under administration. The concern is when you have a minister that is not coming up with creative ideas of how we fill vacant posts, how we get posts funded, how we utilize our resources properly. When you ask for health to be made a national competence, you also need competent leaders at national level to take the mission forward.
What does this now also highlight about the imbalances in the system, the ratios, doctor or nurse versus patient, and the kind of longer term challenges that this presents in the healthcare sector?
The long-term challenge it presents is that we've grown in the wrong places. We're not providing the appropriate incentives to retain healthcare professionals. We have lots of unfunded posts. And when we don't have doctors applying, we then say, oh, doctors are not here, we'll import doctors from elsewhere. Where was the planning when we send our children to go and train in Cuba, when we increase the output through our own medical schools? And now that we are producing, we can't absorb. It means somebody doesn't know what they are doing or they can't do their job. The president has to ensure that this matter is sorted out. We have a crisis in healthcare. We have a crisis of leadership. We have a crisis of management. Stop deployment. Stop political interference. Professionalize the health service, and you'll be able to purchase strategically. But what the minister is saying is unacceptable. He should be giving us a human resource plan to say, for our needs for the country, we need so many doctors, we need so many nurses, we need so many pharmacists, so that we train for deployment. What is he going to do about all the doctors that we're producing on our platform, all the nurses that we're producing on our platform? This is not acceptable. The provinces that are not functioning properly, like Eastern Cape, like Gauteng, need to be put under administration. Health must be made a national competence. And the health minister must come to the fore to ensure that we bring in the human resources that are necessary, we bring in the efficiencies so that we as public servants, me, the minister, the president, all the people that work in our healthcare system should use that healthcare system for our own healthcare needs.
What we also did hear the minister say is that doctors are free to open their own practices. They can work anywhere else, and that government is not obliged to just hire them because it's like any other profession. Easier said than done. I mean, opening up your practice, what does that take?
I think one of the challenges that we have is that we have an oversaturated private market. We have very few people that are on medical aid. And we keep saying people can open their practices. Most of our young people that went to study medicine went there not to serve to the highest bidder. They went there so that they could come and serve this nation. The best place to serve this nation is being employed in public service. And that's where we should create the opportunities for our young graduates. This notion that they can go overseas, it's wasteful expenditure in terms of the resources that we've put to training. We need leadership that shows compassion. We need leadership that prioritizes the citizens of this country, not only the patients, but also the professionals that have trained, so that we should provide quality healthcare services from our public sector that we should use for our own needs. We need a minister that cares not only about the professionals that have studied, but about the patients that need to be served.
So with government...
the notion of where people can go, that's irresponsible.
But I suppose then it leaves room...
Saying, I'm going to treasure it. I'm going to look for resources. I'm going to ensure that posts are filled. I'm going to ensure that the system works.
But the notion that qualified doctors can go overseas is the next best option, because there's a lot of frustration, there's a lot of unemployment, but to be so highly skilled and be sitting at home is unbearable. I mean, so the next best thing is to go overseas, is to explore those opportunities.
No, I think it's terrible for that to be coming from our Minister of Health.
Yeah.
Because he should be looking for resources to retain the skills in here. This is the first time I'll ever hear one of our officers wanting to export our skills instead of retaining them so that we can provide for our people. I mean, some of us, we didn't go to medical school to go and serve people elsewhere. We went to medical school to make a difference in our own country.
Yeah.
And we need a minister that would make sure that that is possible for our young graduates. Not to come and glibly say they can go into private practice, they can go overseas. And remember also that this notion of going overseas, it's not easy for you to leave your own family. It's not easy for you to go and serve elsewhere. When you know there's a need from your own people. Can you imagine? You come from a village, you're now a young doctor, there's still no services out there, and your minister says, go private. There are no opportunities to go private. He says, go overseas. That is irresponsible in the extreme.
Very well. Thank you so much for weighing in and giving us your thoughts there. Health activist Dr. Kgosi Letlape speaking to us about Health Minister Dr. Aaron Motsoaledi's remarks about not being able to absorb the number of qualified doctors in the country.